What's up, healthcare clinics? Nick here with Patient Care Marketing Pros. Are you ready to master your digital marketing in 2025? Well, we have a webinar coming up on January 23rd at 10 a.m. Central Time. We're going to be going over your 2025 digital marketing playbook. We're going to be helping you with your budgets. We're going to be helping you with grassroots marketing. We're going to be helping you with digital marketing, so much more. What's coming, what's changing, all about helping you grow your clinic in 2025. There's a link in the show notes for you to register for the webinar. We hope to see you there. Welcome back to Walk-Ins. Welcome. We're glad to have you for another episode. We have been on this course of having really powerful interviews. Michael, it's been good, but as always, our mission is to help you get more clients, deliver better care, get repeat visits, and scale up. AI has been a hot button on for 24. I think it's going to be even more so in 2025. And we have two guests on the show from Exdion. I want you to lay it up. This is going to be a good podcast interview.
Yeah, absolutely. So we have Thomas Kemp and Mark McKinzey here with Exdion Health. Exdion Health is like a revenue cycle improvement company. So they have multiple products to help encourage revenue cycle improvements and just making things better. Because we know at the end of the day, if you don't have proper revenue coming in, your business starts to suffer. But anyway, so Thomas Kemp here, he is the president and head of healthcare at Exdion Health. And he's kind of funny. His background's got a molecular biology degree and an MBA in marketing. So it's a fun mix there, which I thought was really cool. So cool background, lots of years in the healthcare space. And then Mark McKinzey, he is the VP of business development there. And he's been in the healthcare space for 20 years. He started out in tech and he slowly migrated the business. And so now we have products. I think it's a reflection of that mindset. So welcome aboard, guys. Glad to have you on.
Hey, say hello to the Walk-Ins. Welcome, audience, and tell us, we'll start with you, Thomas. Tell us one thing about you that nobody else knows.
One thing that nobody else knows. I grew up outside the United States, so feel free to ask me questions in French, Arabic, or Mandarin. How about that?
Okay.
All right. Now that's how you tell the whole audience I'm smarter than you. Yeah. Tell them that I'm smarter than you. That's how you do it.
I know things.
I love it, man. Mark, tell us one thing about you that nobody else knows.
A little similar. I've been to 35 countries in my tenure, so that's kind of been fun from a work aspect.
You guys are seasoned professionals. So I've got a lot of questions here, but I really want to spend some time focused on AI, and I want you to talk about ProMax AI. But I'm going to ask a question that I wasn't prepared to ask, but I want to ask it anyway because I bet you guys run into this. What is one thing that people think is true about AI that isn't actually true? Make you think on this one.
I'll take that one. Yeah. How about that?
Do it.
So, in fact, this is something that comes up frequently is we'll get healthcare organizations saying, are our providers going to have to talk to your AI? A little intimidated, right? Are they going to talk to the AI and have to interact with it? In our case, the answer is no. That there may be a chat or something like that with one of our products, but as far as are they communicating, sharing healthcare information, anything like that, no.
I love it. Thank you for clarifying that, because it's one thing for me to say that, but it's something entirely different for you to bring that to the table. So let me lay this up properly. So ProMax AI, I know it's a game changer tool. It's specifically around medical coding and reimbursement. Tell us what it is. Give us a 20,000 foot picture of that product.
Yeah, so ProMax AI is really our provider engagement tool. So, we talk about the right documentation, not more work or less work, but the right work and trying to document charts. And so we assist from an AI perspective, can assist with, did you take their blood pressure? Did you prescribe Zofran? Did you do XYZ? If you did, put that in the chart. So now we can optimize that revenue. So in our case, we deal with evaluation and management codes. Out of that, could go from a level 3 of medical decision making to a level 4 because now we're charting better, we're documenting better, we're assisting with that.
Well, how is the AI incorporated into this? Is it scraping this information and formulating it in such a way that allows you to identify these upgrades and statuses?
Yeah, so I think on the front end of what we do, you don't really think of Exdion as a layer between your EMR system and your revenue cycle. Now, we're a full end-to-end RCM company and can take you all the way to payment posting, but we're able to fill gaps in urgent care businesses where they may not want to uproot their RCM today. So we can help on the front end of coding, getting that information kind of synthesized through our tool, providing information to the providers that will educate them on maybe some better documentation, and then on the back end, being able to report on that. So out of all of those items, ProMax has been really kind of to your point, a game changer from a perspective of being able to engage with that provider that a lot of groups just can't and don't do.
Think about it this way. In the past, a lot of these functions were done by people, right, in healthcare. And what we are doing at Exdion with AI is replacing, bodies or offshoring with AI. It's just more efficient than having, a bunch of people. This is all functions that used to be done by people. We're just applying technology to those functions and simplifying and making it faster and more accurate.
Yeah, and removing administrative burden on the provider so they can get back to, patient care.
Yeah, I think that's one of the biggest things that we're finding AI in healthcare is allowing the doctor, the provider, to be a doctor again and not just be a paper check boxer, right? And trying to check every box they have to check. Because the medical coding space, like my mother-in-law is a medical coder. And so like I hear lots of conversation, and it's great. Like, just, that sounds boring. It sounds like boring stuff they have to do every single day, and but they know the stuff. But at the end, they're a human, and they're trying to connect all the dots. They're going to miss things, or they're going to miscode something, and then all of a sudden, it goes down this long path of an upset patient. Like, there's so many impacts that can happen here, and then just from simple mistakes that people just didn't think about. But yeah, I think that's one of the biggest things. We went to a symposium earlier this year, and I had a big AI session. And we're learning that in the healthcare space is healthcare is 10 years behind when it comes to technology. They're very slow to adopt. And so when they brought up AI, they said, who in here has used Chat GPT? And we're like,
I think 2 hands went up, and one of us was ours. What are you talking about?
There were like 150, 200 people there. And, we're the 2 hands that went up. Yeah, we use Chat GPT every day. And then basically no one raised their hand. They all said, well, our IT people said, don't do it, and they blocked it.
Yeah, so that symposium really focused on front-end AI, right? So they were in there with the patient. They were ambient AI. They were all of these items, while the patient was there. We're post-AI, if you think of it in that context. So, when hands were raised, from what I heard from that, so I wasn't there the last day, but what I heard was, do you have anything for billing and coding? And those hands went up across the tables when the last AI kind of portion was talked about.
Yeah.
So so we were the 2 raising our hands, saying, "We got."
That's right. I looked around and I only saw. Gosh, there was hundreds of people there, and I saw a handful. Like, you could count on both hands how many hands went up, and there was not a lot.
And then the next hand that went up was, how do you log into Chat GPT?
Yeah, that was funny. Like, where do I go? www. But it's funny that you mentioned the back end. So you have the marketing aspect of how AI is being incorporated, and then you have the almost the bedside manner of AI. We saw that with Scribe and stuff like that at the symposium that we both attended. And then y'all are on the back end of that, getting people. So I want to talk about this kind of trifecta that you see in a unique value proposition from you guys, and tell us how this works. All right. You can either make more money or save money. You can help people with convenience, or you can help people with speed. And how is ProMax AI answering those questions? Like, why should I adopt this into my clinic?
Yeah, so if you look at where provider engagement is important, as I mentioned a second ago, was talking about, hey, you may have missed some items in that visit. So based on thousands and thousands and hundreds of thousands of data points that we have for CPT code and diagnosis code, did you do X, Y, and Z? So we can make sure that goes in the chart, because if it didn't go in the chart, it didn't happen, right? So out of that, if we can impart that wisdom with the provider via this tool, then they're going to see a lot better throughput. It's going to be much quicker, so they're not spending as much time having to go and chart. We're calling those items out to where they can just go in and add them in their EMR versus having to scroll through the whole chart to find did they do it or not, because we're calling those things out. So a little bit quicker time to, and we call it in this market payment velocity. So if we can get that done quickly and to the revenue cycle before it goes to the clearinghouse and they've got a clean claim. So ultimately we're reducing denials and rejections. And the benefit there is the average rework, and this is documented for urgent care, primary care, internal med, to rework a claim is $22. You're not getting paid anymore if you do the work. You're getting paid what you originally would. So let's get that out on the front end and reduce those denials. So you're going to see some soft cost benefit there too.
Yeah, because at the end of the day, we recognize that in the urgent care space specifically, the margins are getting tighter and tighter and tighter.
Yeah, they're squeezing.
Yeah, the reimbursements aren't moving at all. I know it's a big push from like the UCA to help with that, but at the end of the day, when a urgent care visit is only netting $15 from a visit, that every dollar matters.
Yeah,
it really does.
And they think, when folks are having to go and renegotiate contracts and they get a 3% lift, the skies are blue again and think everybody's great. But, that's not moving the needle much, for as much work as these folks do in the urgent care.
And one other thing that we've seen a lot of organizations doing is that they will send these charts as is on to a coding company. They'll code it, or even in AI, they'll have them code it and then send that on to the payer. The difference with ProMax is that we're giving feedback to the provider and to the organization. We actually provide analytics to the organization, what their providers are doing. Yeah. For that reason you just mentioned, if they're trying to move the needle on that margin, move it up, well, they need to see what providers are doing. If they can improve documentation, and we're giving them the data, and we can help them educate those providers to be more complete with documentation, or ask questions, or do, to increase the potential reimbursement for that visit. Because that's really what we're doing is, the visit is the visit. But if there are some, subtleties, things that they can do to improve the reimbursement for that visit, that's what our AI is able to capture and give feedback to the providers and to the organization globally, what they could do better.
That feedback loop is super important, because we have a client that we've talked to before where he's on the business side. He's still a doctor, but he runs his urgent care. And he had situations where he would pull up a chart from a visit, and he's like, you say that this person had this issue, but you didn't run this test. Why didn't you run the test? And I'm like, well, I just didn't think, we have an on-site lab. You could have gotten the test back in like 10 minutes. Why didn't you just keep them for the test?
Yeah. And what's his number?
Exactly.
We'll talk offline. I get you connected. They're good people.
But it's the reality of, because that provider probably didn't even think about it, right? It didn't cross their mind, or they weren't educated on, like, we could actually do this very quickly. We don't have to send things off because we now have an on-site lab. But also it's that mindset of, we all have this issue where if we don't have something kind of telling us, like, here's some feedback, it's not bad feedback, it's just, here's some feedback you need to know about to improve some stuff. And then honestly, I don't know if this has happened yet for you guys, you may be able to catch some fraud situations where a provider is manipulating things, and yet they don't know about it until they see it later.
No, that's a good point. So this is probably a good segue that, kind of our three pillars is minimizing and reducing denials and rejections, optimizing revenue, but maintaining compliance, right? So to your point about fraud, we want to have a defendable position. If we're doing the coding for this group and we've got the right documentation, we're completely comfortable, defending that. So out of that process, we want to give that assurance to the urgent care group that, yes, we can label this as for an ENM code level 4, level 3, level 5, whatever it is, as long as we've got the supporting documentation, then we're in a good spot.
Out of desperation, people make stupid decisions. And
this is a great point, that even by saying that, by nature, we found that some of these providers are conservatively documenting, right? Because if it's a lower code, then they're not going to get as much scrutiny. But then to the gentleman that had, why didn't you do this test when it called for it and you didn't do it? So there's some, and we call it education. We don't say training. We say educating the provider. Training's a bad word. But out of that, the benefit is to educate, because I would argue that by giving them that test, you're providing better patient care, right? Mm-hmm. So out of that, there have got to be some triggers that we can identify that says, hey, did you do X, Y, and Z? Please put that in the chart. I don't know if our AI says please. We just say put that in the chart. But
please
but
do
out
it.
Of that, if you're able to document that, then I would argue, and there have been cases where you could say that there is better patient care, better treatment plans because they have more information.
Mm-hmm. Oh yeah.
So Thomas, I want to come to you real quick. I mean, you're spatting out multiple languages, years and years of experience in the industry. You've seen a thing or two, if I were to wager a bet. And Mark, I'm not going to take any of that away from you either.
Well, no, you're just telling me how old this guy is. That's what you're doing.
So I'm putting a little bit of a gap there only to say, like, you've seen trends, you've seen fads. Is AI a trend or a fad, or is this something that people really need to think about adopting quickly and putting into practice?
Yeah. So the reason I am here to begin with Exdion is because this is a trend. In fact, this is a game-changing trend you're going to see across healthcare. Because while we're really focused on talking about using AI primarily in the urgent care setting here, I think what you're going to see as time goes on is you're going to see it everywhere in healthcare. Because because I'm old, I've seen a lot. Healthcare is plagued with inefficiencies, frankly. Yeah. And anyone who's been in it for a while will tell you that there's inefficiencies everywhere. And that's the one place where AI can help, not just in healthcare, but I think the world in general, is to improve efficiencies or where there are inefficiencies that can drive down costs. And I think that's the most exciting part of incorporating AI into healthcare organizations is to drive down unnecessary costs, that not just costs, but provide opportunities for improving patient care, because time spent by providers on inefficiencies on administrative tasks don't help anybody. And I think that's the most exciting part, is that organizations can focus more on patient care and less on administrative tasks.
Yeah. I mean, to me, it's, the doctor, home visit doctor that come by and visit you that back a long time ago. And then we came into the modern world where now you have to go to the doctors, all the compliance tied to it. Now AI is kind of like allowing that doctor to do home visits again, basically, where they can just do that. Like you said, focus on the care. All I got to say is with AI, I hope one day we'll have a full body scanner and I can just walk through a scanner and then know exactly what's wrong and let AI tell me.
Probably not far behind.
No, really not, honestly.
That's where, it's the kind of thing like that where we're headed, and where it's the efficiency where you're not having to have people entering stuff in computers and stuff. You're gonna have voice recognition. You're gonna have diagnoses. One of the most exciting areas right now is AIs that read X-rays, for example. It's amazing stuff.
Yeah, I even saw like on the mammogram thing, AI now involved where it's detecting things that a human eye couldn't recognize at all. So it's just amazing.
Yeah. And I was in that business. I was in women's imaging for a number of years on the development side, corporate development, and that was 2016 to 2020, and it was just getting on the cusp of, they did 3D tomography. And then that was starting to do contrast, where they were injecting the fluid so they could see it more prominently. Now they're having AI companies that are actually able to read, and then they're putting that up against, a radiologist in the field, and then comparing notes. So it is unbelievably fascinating, the amount of technology for AI. Yeah.
Well, so I believe that money is attracted to speed. Okay. Yes. And, everybody, being a clinician, being in the urgent care space, at the end of the day, you're a retail healthcare, so you're in business to make money. All right. So I want to hear about the early adopters. Maybe you have some case studies where people have stepped in early and it's made a profound impact on their clinic. I know you can't go into too much detail, but like give me an overview of somebody that's been an early adopter, how it impacted their business, and some of the results that you've seen from that.
Yeah. You got it.
Yeah, so we have quite a few of those. I'll give you a specific example of one in a medium-sized urgent care organization with about 10 clinics or something like that. So typically, what we see is when they work with Exdion, there's two areas that emerge fairly quickly. One is upfront is on coding. So in general, when we talk about coding, we're in urgent care. We're looking for level 3, level 4 E&M codes, right? Obviously, the clinic gets paid more with level 4 E&M codes. So the first place we can help people is help them move from level 3 to level 4 E&M codes. How does that happen? It happens by improving the documentation. So this is what we've seen with our folks. We give their providers feedback to understand what they need to do in order to achieve a level 4 E&M code or what's missing. If they do, because sometimes we have to actually reduce the code because they didn't provide enough documentation. So in this particular case, we were initially, at least, we were downcoding a lot of their charts because they didn't have adequate documentation for level 4s. But over time, their providers get on board, and we start seeing more level 4, or the ability to have E&M codes at level 4. The second part of this is by improving documentation of the chart before it goes to the payer or to the clearinghouse. Mark mentioned earlier about reducing rejections and denials. So the second part that we see an impact on revenue is that, and Mark talked about velocity of collecting their payments from the payer. We can improve velocity by having those clean claims. That's the term we use, clean claims going to the payer, and they start getting paid instead of being 150, 180 days out because they've had to make adjustments to the claim for errors. Now we get clean claims, and so instead of that claim coming in 190 to 150 days, we can get it within 60 days. And so not only are they getting paid faster and frequently getting paid more. Yeah. So this is actually a very typical sort of a use case that we see, where we see two phases of impact on their revenue. One, on the initial coding, right? So that's up front, and then 2, on the velocity, the time it takes for them to get paid.
And just let me add to that, if you would. On the payment velocity, the 11 to 20 days is a great peg to, time for getting reimbursed. And so we have business intelligence and a dashboard that we provide management and, any of the clinical folks that kind of showcase all of the things that we're tracking, right? All of the metrics. So you'll be able to see that with our dashboard. You'll be able to see how the providers are interacting with ProMax AI. You're able to see trends. You're able to see the financials. When are they coming through the door? How long is that taking? How many visits are you seeing? We don't do like door-to-door times. I know that's a pretty heavy metric for some folks because they're on the front end there. Sure. But based on the services that we're providing, we're able to provide that dashboard and those analytics, and it's actionable, right? So you can go and have targeted education, not training, education toward
no dirty words on this podcast. Yeah. You keep your mouth shut.
And so we have education where, hey, provider A is great at documenting for respiratory. And then another specialty like ortho, he or she needs help. And then conversely, provider B is great at ortho but needs help in respiratory. Now you've got some tactical education for each provider versus this overarching type of training that you have to give to all providers. Does that resonate?
Yes, absolutely.
Yeah, I mean, anytime you have good data where you can, because we're in a data world, right, where there's tons and tons of data that gets thrown at us every single day. Yeah. Well, allowing something to say, no, look at this and take some action here. Mm-hmm. Yeah. Not only just say it, because there are many times where we have all this data and we don't know what to do with it. and then we just let it go right past our eyes. And we're like, well, that's great, but I don't know where to go with any of it. And that's just allowing you to take that, like you said, taking that proper action to make like, here's some education for you, because this will be a great thing for you that will improve things. Because in our world, when urgent care hires us, they're looking to increase volume. But if they could increase the quality of the visit and the quality of the reimbursement and the actual claim, the volume isn't as important again. We're not just trying to chase down this rabbit of like, I need more and more numbers. Well, maybe you just need better numbers too, like just to increase what you got. So
and it is on their existing patient base, right? We're not doing any of the marketing to try to get more folks in the door. That's more on the front end, and the marketing was for the urgent care group. So, but what we have to work with, we're trying to maximize or optimize. Yeah.
I love it. So you guys, I'm going to bridge the gap here a little bit before I take us out. In a story format, a lot of people hear us talk about marketing. When I'm sitting down with a client or I'm on a Zoom call with a client and I'm focusing on helping them build their clinic, if they haven't paid me or I'm struggling with the financials of this account, I'm not thinking about how I can help them grow their clinic. I'm thinking about how I can get paid. And let me kind of position that with you guys. If y'all are helping them code better and you're helping them get the proper reimbursement and you're removing that through AI from their thought process, they're going to have a more human interaction with their client, because at this point, now I'm trying to serve you. I'm not trying to think about the proper code and whether or not I'm going to get paid properly.
Better patient care.
And that's, at the end of the day, our goal here is to help you deliver better care. And I believe that ProMax AI helps you deliver better care, because now you're thinking about your patient, not about how you're getting paid.
Right. I mean, it's tough to tie because we're not tracking net promoter score for them. But I would argue that yes, because you're providing, like I mentioned a second ago or earlier, a better treatment plan, and you're putting the right documentation in. So you are treating that patient much better than you did if you were documenting conservatively, because you didn't take that test that the physician said, hey, this documentation supports it. Why didn't you administer the test to help the patient? And I mean, that's at the end of the day, the goal is removing that administrative burden, letting them treat patients, and then feel comfortable that, when they're documenting, we'll catch anything. They don't have to worry about it. We can catch it and say, hey, did you do this?
Another use case that we could mention is that one of the larger urgent care providers in the United States we work with, and their medical director actually takes our ProMax AI data to build education specifically tailored for their providers.
Makes sense.
That's so cool.
Doing exactly what you're talking about. This is a way for them to ask questions or when they are seeing a patient to look for very specific things. Mark talked about blood pressure. You could talk about blood glucose. They could ask them about diabetes. There's a number of things they can do, but based on our analysis of the patient visits, that medical director can build customized training for their entire team.
And that, honestly, that type of training, education, right? I'll say training.
Education.
There you go. But when you're providing, because here's the thing, we know that a lot of education, we're like, this is very boring. I don't want to deal with this. I just have to check a box because they told me to.
Yeah.
But if they're providing education, like, actually, I do need to know more about that, because I've been a little fuzzy around it. Like, it's going to be more receptive. I think they're going to have better outcomes from like just improvement on the providers, just because they're getting information they probably really want. They just didn't know to ask for it. So I think it's awesome just how they use that.
All right. So I want to pose this question to either one of you or both of you, if you have an opinion about it. So for our clinics that are listening today, they're hesitant to embrace AI. What word of encouragement would you give them based on what you know about it?
So I'll take this one. And the benefit is we will take your own data and run a use case analysis for you and say, hey, let us show you or not show you that there is an opportunity for improvement here. 10 times out of 10, there's opportunity for improvement. So we're using their own data. We'll take it, we'll do a use case analysis. We'll sample a number of charts. We'll run that through our tool, and then we'll showcase exactly what that potential would look like. And then we annualize that over, let's say we take a month worth of data, and then we annualize that to say, hey, there's some potential opportunity here, reducing denials, optimizing revenue, maintaining compliance in our program that could benefit the group. We want to show that there is ROI, right? Proof is in the pudding. And out of that, give us that shot. And then, and the way we structure our agreements is let us prove that out. And we'll show you. And then we'll roll it out to all your locations and off to the races.
Yeah, they're listening to us right now. I mean, we'll do that for free. We'll take your data.
Yeah.
Right. Run it through our AI. Right? It's just like we really do it. Run it through our AI. So there's nothing scary that happens. Run it through. Give them some feedback about what we can do for them.
Yeah.
Free.
Yeah, and it's no obligation, right? There's no pressure, but it would open their eyes a bit to, man, am I really, do I have this opportunity? And so then it kind of begs the question, how can I move forward, right, with this program? And if you look at average, you're getting $100 in reimbursement, and we can raise that, for easy numbers, not saying this is actual, but for easy numbers, 20%, we're taking a pittance of that. So yeah,
that's the most important question that we get from people. This is going to cost me a fortune.
Yeah.
We're trying to make money and not spend it on new technology.
Oh, yeah.
Look, the whole premise behind what we do is the work that we do should pay for itself easily, many times over.
Yeah.
And so that's the whole idea. And that's one thing we would tell people who had concerns about, well, this is going to cost me a fortune. We're small. We don't make that much money. We're trying to help you.
Yeah.
And our solution should put you in a position where it pays for itself.
I mean, honestly, I don't see how it couldn't, right? I mean, as long as they're taking action with what the AI is telling them and not just saying, hey, that's a really cool tool, but I'm not going to apply it. That's a different story. I'm sure there's been challenges there, but yeah, at the end of the day, I mean, the way you guys are talking about it, I mean, I could see an easy 10% increase in overall revenue with the same patient volume as they've always had.
Right.
And that 10% could be somebody's job. And then we're not even talking about how much more capacity that now opens for the clinic that they may not have had in the past. And so
and if you guys are looking at going up for sale as an urgent care group, or you want to do acquisitions or you want to do de novos in certain markets, I mean, we've got tools that we can provide to give you a little bit more of an informed decision, especially about your dollars that you're bringing in and what that looks like. So, there's some benefit there as well.
Nice.
It is an exciting time in AI and to be a clinic owner and the things that are coming down the pipeline, especially when you're getting squeezed. Thomas and Mark have made an offer to the Walk-ins Welcome audience. We're going to leave a link in the show notes for them to be able to connect with you, but let's go ahead and say, what's the best way for them to connect with you to get this free analysis of their data and coding?
I would just say Exdion Health, EXDIONHEALTH.com. And then if you go through that route and do the info button, for more information, and you can even put walk-ins welcome in the subject line if there is one, and then we would know, where that's coming from. We're happy to operate that way. I can post my email address at the end of this, or one of my guys, I have his email address as well. So you can get in touch with us anytime.
We'll drop all those links in the show notes. You guys are the average of the 5 people that you hang out with. You've been hanging out with myself, Michael, Thomas, Mark. I hope this has raised your average. We want to welcome you back for a future episode. I've enjoyed this. AI is a hot topic, and you guys are welcome to come back on the podcast to talk more AI with us if you want to. Love it.
Awesome.
All right.
Thanks, guys.
Cool.
Much
Thanks for having
appreciated.
us, and we'll see y'all next Wednesday. Have a great week.
Thanks for having us.